Hi, I'm Dr. Bo with San Antonio Medical Associates here in Alamo Heights. I'm joined by Alina, one of our physical therapists that work here. And one of the things that we kind of wanted to talk to you about today was we frequently get asked about stretching before and after exercise, kind of what to do and exactly kind of when to stretch and how to stretch. So we're going to kind of walk you through like the current recommendations and then a couple stretches and some foam rolling. What do you typically recommend? Should we stretch before? Should we stretch after? Dynamic versus static stretching? What do you think?
So good questions. It's never good to stretch a cold muscle, so we want to warm up first. Some light aerobic activities such as walking or stationary bike, just 5 minutes is enough to get the blood circulating, the muscles warm.
Okay.
Stretching we recommend after your workout, so towards the end. Static is no longer considered the best. It can actually cause micro tearing of your muscle. So research has showed us that dynamic stretching is better and less likely to cause injury and so on. So holding on to the TheraBand, doing a straight leg stretch, so keeping the knee straight, the foot flexed in towards you, and bringing it up just to the level where you feel good stretch behind, and then relax your upper body. Yes, and now bend the knee, slowly, and then slowly extend, stretch. Another way is using the foam roll. Foam roll though takes a little bit of effort with your upper body, so there's a couple ways to do it. Traditionally on the mat or on the floor.
Very simple motion, just kind of back and forth. And then as you go, you kind of turn a little bit more. And then you're almost getting into that IT band area.
And if you have a trigger point, which is a knot or an area of tension in the muscle, you can stop or pause on that point and then bend the muscle. So allow the muscle to shorten and lengthen. So for example, if you go onto your front of your thigh, a lot of people tend to get them in their quadricep. Let's say it's in the middle of the muscle belly, and so roll forward a little bit, right there, and then just bend, put a little more pressure by pushing down, and extend. You can do that a couple of times, even roll back, touch here or there to just kind of work into that muscle knot.
Now for some people who aren't as flexible and have a hard time kind of maneuvering in these different positions to
Yes.
get there, what do you recommend?
So then we can use an elevated surface.
Okay.
So we'll come up to the table here, placing it on your couch or on the edge of your bed, and then placing yourself, so for your hamstring, elevating your butt, but because you've got your foot planted into the floor, you can push with your leg, and that makes it a little bit easier to go back and forth. You may not get as much pressure, but it still can be effective. And you can still maneuver yourself to get inner thigh for your seat and relieve them as needed.
Excellent.
Well, I'm Dr. Bo from San Antonio Medical Associates. I'm accepting same day and next day patients. If you have any questions, feel free to come by. And again, this was Alina, a wonderful physical therapist.
Thank you.